days
have a
ago.
positive
Alzheimer's, cognitive.
I was either going to give up completely or
With the idea of using very and structuring water.
So there now is.
Dr. Shawn Tassone has studied mind-body medicine as well as conventional medicine, and he's put that mix together in an amazing method of healing all sorts of hormonal issues, everything from PCOS to getting off the pill to helping women after the menopause. He's worked on a whole bunch of hormonal types, and he can help you find out yours. Please welcome Dr. Shawn Tassone. Hi, everybody. So welcome, Dr. Shawn Tassone. It's so great to see you.
Hey, thanks for having me.
We are really excited to have you speak because so many women, either going through the menopause or just in any stage of their lives, have difficulties with hormones, and you're a real hormone expert. Now, I've heard you say something about 12 different hormone types. Do you want to explain what that is and how you determine them?
So over the last 20 years or so in private practice, I think I probably sat with over 40,000 women. And what I noticed was years ago, probably 14 years ago, Suzanne Summers referenced me in her book, The Sexy Years, which was about her struggle with breast cancer and how she found bioidentical hormone replacement. And so I started getting lots and lots of people coming to finding me because they were struggling with things. And what I noticed was over the years, I kept hearing similar storylines, you know, with decreased libido and insomnia and weight gain. But all of these things, they had different stories. And so I kind of started talking to my patients with reference to these storylines. So meaning what I would call archetypes, what Jung would call archetypes, in the sense that there's an overarching storyline. So like a woman, say, who has a testosterone deficiency, that storyline was what I call the nun, like NUN, because women that have low testosterone have issues with isolation. They don't like to go out and do stuff, obviously decreased sex drive. And I jokingly say that, you know, the good nuns don't have sex. So it was a storyline, and none of these stories are good or bad. But when I would talk to patients about hormone imbalances, like I would say I have a testosterone deficiency, you kind of get that glassy-eyed look. But if I started telling the story of the nun, there would be a light bulb, like, yep, that's exactly what I'm talking about. You know, I'm tired in the afternoons, I have decreased sex drive, you know, I don't feel like going out and doing things. And so they're cloistered. And so what I did was I was, other than lab testing, because a lot of women don't have access to necessarily get their labs checked whenever they want. I really sat down with this. I'm a math major in college, and I started trying to figure out a way to have a quiz online that wasn't like 5 questions. It's a pretty detailed quiz that's algorithmically loaded on the back end, so that if you answer these 36 questions, it will be able to pick up on your storyline and just give you an idea. Obviously, it's not purely scientific because it's not blood, but it's a good starting point for a lot of women that are trying to figure out why they feel the way they do.